rebalance system works primarily by decreasing a main hormone called cortisol. It regulates it in the sense that cortisol is a hormone that has both positive and detrimental effects. So too much is sometimes a good thing, but most of the time a bad thing. And too little can frequently be a good thing, but sometimes can be a bad thing. Cortisol's a tricky hormone to explain because it fluctuates multiple times throughout the day, even multiple times throughout an hour. So cortisol, some people refer to it as the fight or flight hormone. So basically, if a mountain lion were to run in front of me, I would have a big surge of cortisol, which would happen almost immediately. Certain other hormones go with that, like noradrenaline, adrenaline. The other name for adrenaline is epinephrine. So norepinephrine or noradrenaline to increase my heart rate, increase my blood pressure, increase my awareness of the situation, give me the ability to flee the mountain lion if that's the case, or do whatever, right? The same thing can happen on a New York subway. In fact, you can have surges of cortisol depending on what time of day you're riding it, I figured out. You get benefit from cortisol in the example I just gave. It helps us with that fight or flight response. Another example, or another time we get benefit from cortisol is during certain illnesses. For example, when elderly patients who notoriously don't make cortisol very well come into the hospital or come into the emergency department with like a pneumonia or a sepsis or some sort of illness, we frequently give those patients an intravenous dose of hydrocortisone, of cortisol, a glucocorticoid. And we do that because the studies show that they actually have a better course in the hospital. Less of them die, they get over their illnesses more quickly, etc. So in that particular group of people, elderly people or people with adrenal gland dysfunction where cortisol is produced, we frequently have to give them extra cortisol during certain treatments or certain phases. The problem with cortisol, however, though, those are sort of some of the benefits and important things. The problem with cortisol is, in today's world, is the fact that people kind of redline their cortisol all the time. In other words, the examples I gave, I'm thinking that, well, we start from sort of a normal cortisol level and all of a sudden you have a surge because a mountain lion's in front of you, or you have a surge because you have an illness that you need to get over. And then that cortisol level comes back to normal. And it comes back to a baseline or a steady state. The problem is these days, not enough people are reaching that steady state, and they're kind of having elevated or redlined sort of cortisol levels throughout the day, the week, the month, and that can be brought on by a number of different things. I'm sure that certain aspects of social media, for example, contribute to that, either because people are staying up all night, watching videos and TikTok and YouTube or whatever, or because they're seeing things that make them think they're increase their stress level or make them think they're inadequate in certain ways, and they're worrying about all sorts of stuff. In today's world, I think our bodies from an evolutionary standpoint aren't adapting well to all the stressors in life, and we're getting this big level of cortisol. So the rebalance system is really designed to mitigate that redlining of cortisol and to bring cortisol back into a normal sort of hormonal balance with other hormones. If you're producing, as a person, tons of cortisol, there's a couple other things going on. Number one, you can't as effectively produce other hormones. It's like baking a birthday cake. If you need flour and sugar, but you've used all your flour and sugar, making something else, you can't make a birthday cake, right? So if cortisol is sort of the birthday cake and you don't have enough ingredients in this situation would be like cholesterol and other basic sort of precursors of cortisol and different chemical pathways. If you're using everything up making cortisol, then you can't potentially make testosterone or estrogen or progesterone or other hormones that are important to be in balance. A surging of cortisol not only can't you make other hormones, but you block the effect of other hormones on the receptors. So certain hormone receptors which are sort of interchangeable and can potentially be a receptor for other hormones like testosterone, for example. If you're filling those receptors with cortisol, then you're not getting appropriate function out of the testosterone that you do have around in your body. You know, there are a lot of things that, from an evolutionary standpoint, like the example with cortisol before, right? Evolutionarily speaking, you know, I can substitute a mountain lion here locally for like a wildebeest or something if you're a caveman, right? And I'm gonna be like, okay, so you're being attacked by some wildebeest or some other caveman. But they didn't have, you know, they had this ability to surge their cortisol appropriately and bring it back to level, but they don't have all this background stuff that keeps their cortisol. Like, that's something we've invented over the years, and it seems to be getting worse. And from an evolutionary standpoint, we haven't adopted to that in our bodies. I mean, we can't be redlining cortisol like that all the time. And unfortunately, I think evolution is delayed in that sense, because it hasn't caught up to our technology and our poor sleep and our 24/7 media and phones and all that stuff. So I don't know what's going to happen, but if the evolutionary leader was smart, he or she would certainly make some better adaptations to cortisol and would keep testosterone and estrogen levels higher throughout life. Yeah, for sure.
Sounds right.
The main function of the Rebalance system is to regulate those cortisol levels. The secondary function, this is especially of the dream product, the nighttime product, is that sleep is something that, if you look at studies on sleep, the entire world has become terrible sleepers for the most part. Maybe it's social media stuff, or the ability to communicate 24/7, or people, you know, jumping on their email because they think of something at, you know, 2 in the morning, where it used to be, well, you had to wait till you actually got to the office to talk to that person, or whatever it is. Sleep in and of itself is super important for the secretion of many hormones, and certain hormones only get secreted during certain phases of sleep at night for very brief periods. We talked last time about human growth hormone, for example, leptin, other hormones that control important functions like muscle mass versus percent body fat, energy levels, storage of nutrients. Those sorts of things all get affected if people don't sleep well. I kind of look at the system as a system that you need to take all three products throughout the day. You can't take one product and expect it to work the whole time. The studies that we have are done, the ones that show that we have, you know, increased levels of testosterone, estrogen. Those types of studies were done while people were taking all three, you know, of the parts of the system, and they're kind of synergistic in effect, where they're kind of 1 + 1 = 3, and they kind of build on each other to help regulate that over a 24-hour cycle. What we've seen now, we've been monitoring, you know, we already have some studies that are complete, and we're in the process of another big study, and we've been, Russell's been looking at the data too, so he probably can give some more insight about this, but we definitely have people that respond within the first week or two, and then we have others that it takes 2 or 3 months to sort of feel the full effect. The way I look at it is that the Rebalance system doesn't preclude you from using other products. In other words, let's say that someone is on an antidepressant. Let's say that someone is on an anti-anxiety type medicine, a prescription one, let's say. Let's say that someone is you know, taking some sort of other medicine to help with hormone regulation. What the Rebalance system will do will be potentially to make those products more effective. So maybe now you're in a situation where you're on an anxiety medicine and you're bringing that cortisol level down, your anxiety's going down. Maybe you don't need as much of the prescription medicine. Maybe you can get off it completely. Potentially you could use a lower dose, which improves the safety profile. I think they're not like mutually exclusive. I think you could start with the Rebalance system and see what type of benefit you get, and hopefully that solves the issue or problem that you're having, which it very well may. If there's still some lingering effect, let's say it reduces anxiety 80%, but there's certain times when you still feel a little anxious, maybe your doctor will help you with a pill that you don't need to take every day, but you can just take it once in a while during those times of anxiety or panic or whatever creates that. Maybe it has to do with flying in an airplane. So the Rebalance system works great, but when you get on an airplane, you still feel a little bit anxious. Well, one of the options is actually to go up on the dose of the Rebalance system for those particular times. Another solution might be to get a different medicine to kind of add on top of it. So I think that it's really can be kind of customized to each person, but the safest, and that's the other big thing with the Rebalance system, it has a fabulous safety profile. We haven't found any real problems with it or any areas in which it's not safe. So if you're trying to get the most bang for the buck in terms of taking something that's ultimately almost totally safe, as far as we know, totally safe, and can help with a problem like these surges of cortisol, anxiety, low testosterone, menopausal symptoms, sleep issues. If you're using it for those things, most of the time you will get great relief from those things, but you won't have any safety. When you get into prescription meds for like anxiety and things, there's a lot of safety issues, addiction, tolerance issues that can come up with those types of meds. The majority of the ingredients, I should say, in the product are really water soluble, if not all of them. So in other words, you just excrete them through your urine. There's no buildup in your fat cells or your other organs. You're not ending up in a situation where you can really overdose on it. Now, would I recommend taking a whole bottle at once? No, probably not. But I think in those certain situations when things might be getting more stressful around exam time, if you're a student, or maybe it's when you're a parent, when your students are done with exams and they come home, maybe you need to up your level. And I think taking double the dose is certainly a strategy that we've employed with several of our patients. Taking a double dose during certain times when you think it might be more effective, or you anticipate the need to have less anxiety because you're going into an anxiety-provoking situation or whatever. I think you can take double the dose, and we've sort of tried that. So I think it has, because of the safety profile, I think it has a lot of flexibility. And that kind of makes it more of a customized, individualized product in the sense, so you can use it in that way. We certainly don't have a study that I could point to regarding the Rebalance system that says we should cycle on and off or any of those sorts of things. My gut on this is that if it's helping you, you should stay on it. This is like me telling someone that if they have a family risk of cardiovascular disease and they have lipid abnormalities and other stuff, I'm going to start you on a preventative strategy. And that preventative strategy might include fish oils, EPA. It might include appropriate vitamin D doses, for example. To me, this is a similar strategy, because if I can increase levels of testosterone in both men and women, I am decreasing the risk of cardiovascular disease, obesity, diabetes, and all these other risk factors which basically lead to early morbidity, sickness, or even mortality, death. So I don't think there's any reason to go off it, frankly, if it's working for you. I think you would consider it to be a supplement that will help you in terms of longevity, will help you in terms of preventing other diseases. Treating symptoms like this, like treating menopause, treating anxiety, treating poor sleep, all these things, it's not an all or nothing black and white thing. I mean, I consider it a great success if I can take someone who's having, 10 hot flashes a day and sweating through the sheets to having, maybe a couple hot flashes a day and sleeping much better 90% of the time. So, again, in my head, would I introduce potential risks of hormone replacement therapy just to get that to zero? Yeah, probably not, and it really depends on the patient and the patient's family history and the risks the patient has. But that's why just right, out of the gates, the Rebalance system has so much potential, because if it works well for you, the side effects just don't exist. It's less expensive than prescription meds, it's less of a hassle, it's less risky. I have to monitor prescription meds with blood draws. Initially, if I start someone, I do an 8-week blood draw, and then I space those out, 12 weeks, whatever. We have to change doses all the time because tolerance levels can change with those prescriptions. So it's a much simpler, much cleaner, much less expensive, and much less time-consuming way to deal with those different symptoms. It's really hard because, and especially this goes for women, less so for men, is there's a lot of fluctuation in hormones even during menopause and perimenopause. In other words, it's like shooting at a moving target sometimes when you're trying to regulate hormones, and especially the closer they are to having menopause. The farther out they go, it's more like a man. It just sort of is all dwindled in terms of hormone production, and it's just much simpler to deal with because you don't have the introduction of some days a woman maybe secreting much more testosterone or estrogen or something like that, and then 5 days later they're not secreting any, and it's all over the place. So I think people have to recognize that it's never really perfect and easy, especially around maybe the first 3 to 5 years around menopause. Certain testosterone therapies are actually used to treat coronary artery disease, specifically coronary artery spasm. We inject testosterone into the coronary arteries. And then this article comes out on Friday. Talk about a timely article, right? It's called the Traverse Study, and it's a study of a 3-year study of people, and it big headlines, New England Journal of Medicine, presented at the Endocrine Society 2023. Testosterone therapy does not cause any detrimental effects on coronary artery disease. So then you take the next step and you say, okay, coronary artery disease, strokes, heart attacks, peripheral artery disease, it kills probably 75 or 80% of people in this world. So optimizing testosterone is clearly a good strategy because people have better lean body mass to percent fat ratio, less coronary artery disease, less diabetes, less obesity, they're happier, less stress. So bottom line is, all that old stuff that we were sort of taught in medical school has been debunked over the last at least 15 years, and now with a very definitive study. Longitudinal, double-blinded, placebo-controlled, like the real deal study that made it through the peer review of the New England Journal. As a clinician makes a decision about a patient, we're always, just like a lot of things in life, I guess, but we're always weighing sort of the risks and benefits, okay? So if someone comes to me and they're in a situation where, let's use the hot flash example, they're starting to get some hot flashes. They're kind of just going through what we call perimenopause, around the time of menopause or menopause, and they're starting to get some hot flashes. Well, the first thing that I would try is something that has a, completely safety profile, if you will. So I would probably try, and which I do in my practice, something like the Rebalance system. A month to 3 months, see how they're feeling. Some people feel some effects in the first month or so. Others, it takes a little bit longer. If I can eliminate their symptoms or bring them to at least a tolerable level, then quite frankly, I don't have any interest in introducing another type of treatment. However, if I can't bring their symptoms into a tolerable level, I may introduce, in this case, maybe some estrogen replacement of some sort. Okay. Now, the issue with estrogen replacement is, well, you go down this kind of pathway. So if you give a woman estrogen and she has a uterus, has not had a hysterectomy, then you have to give her progesterone because you can't have unopposed estrogen on the uterus. So now you have two hormones going. And then you have to think about, okay, what are the risks of those hormones? Well, breast cancer comes to mind. It's a risk of both hormones, right? And then you can turn it around and say, okay, I'm treating a woman who has menopausal symptoms, but she's had breast cancer. I'm certainly not going to give estrogen or progesterone, but I can clearly use the Rebalance system to treat that person. And that's a case where maybe I'll double the dose or something along those lines if they're not quite getting effect in the first 90 days, let's say, somewhere in there. What people have to recognize is that treating symptoms like this, like treating menopause, treating anxiety, treating poor sleep, all these things, it's not an all or nothing black and white thing. I mean, I consider it a great success if I can take someone who's having, 10 hot flashes a day and sweating through the sheets to having, maybe a couple hot flashes a day and sleeping much better 90% of the time. Some of those benefits are, it's not just the elimination of hot flashes, which is an annoying symptom and it might, affect their sleep, but it's bone density, it's hair loss, it's skin dryness, it's painful intercourse, it's I think I mentioned sleep. If I didn't, sleep disturbance, not just though from having hot flashes, but just from having sleep disturbance outside of hot flashes. So there are a lot of physiologic effects that are really important. And the studies are clear that we optimize those, the treatment strategies around 5 to 8 years around the time of perimenopause. So when someone first goes into menopause, we treat them aggressively and we consider tapering off those treatments around 5 to 8 years. Again, I'll go through the testosterone example, which is similar to the estrogen, example, but you have a signal that's secreted from your brain. Now, there's two areas of your brain, and one area talks to another area, and the other area sends a signal down to your testes and says, okay, make testosterone. And if you make enough, the signals are dimmed down a little bit because you don't need to make more, and it's this self-regulated system, right? Eventually, as we get older, and in men, probably around age 30, 35, there's sort of this slower dwindle. The first thing that happens is the brain signaling isn't as robust. So it's talking to the testes still, but there's not quite as much, it needs to be kind of yelling at the testes and it's whispering, okay? And the testes aren't quite hearing all of the signal, so although the testes are functioning normally, they're not getting quite enough signal to produce enough testosterone. Okay, and that's one strategy, and that's a true endocrine disease, and it's called secondary hypogonadism because the secondary organ, the brain, is talking to the primary organ, but not robustly enough. So we can actually amplify that signal if we need to as a way of, increasing testosterone. The second thing that happens a little bit later in life is the testes themselves don't respond very well. They don't have the ability to make testosterone anymore or to any great level. Okay. Same thing happens with women and ovaries and estrogen. It's just the analogous situation. So basically what we have to do in those people is we can't give more of the signal from the brain to talk to the testes. We can't amplify that signal because the testes are deaf, essentially, in my prior analogy, right? So now we actually have to give testosterone from outside the body called exogenous testosterone. So those types of scenarios, that's just part of aging. Some people will call it normal aging, and I guess you could call it that, but it's not healthful aging. It's not helping your health span. It's just something that happens. The literature is now really clear that sort of jumping in the middle of that, like with the Rebalance system, jumping in the middle of that is really beneficial as you move forward in life, and you get older, you're a much healthier, older individual. So it's a lifelong commitment, in my opinion, because there's evidence that it's going to help you be healthier. If you decide at some point in your life you don't want to be healthier, then I guess you can go off it. Yeah.